Thank you. I welcome this opportunity to present our work. First of all, why am I focusing on self-reported cognitive difficulties? Self-reported cognitive difficulties have a very bad reputation in the research world. They're weakly correlated with measured cognition. They are correlated, but they're weakly correlated, and they're influenced by several non-cognitive factors, especially mood variables. On the other hand, as Dr. Lam was mentioning, this is how cognition is present in the clinic setting, and they're more predictive of function and quality of life than measured cognition is. So they are very important. So the objective of our study was to estimate the extent to which social adversity influences worsening in self-reported cognitive difficulties among older adults living with HIV. Data for this analysis came from the Positive Brain Health Now Canadian study that enrolled 856 participants from 5 clinics across Canada. They were adults over the age of 35 who had been living with HIV for over a year. There was no substance use disorder, and people were free from dementia. They were assessed every 9 to 12 months, and at each visit we measured self-reported cognition, initially with the patient deficit questionnaire, and then with the C3Q, which is a test that we developed following the guidelines from the FDA for the design of tests for self-reported outcomes. And the items from these 2 tests were combined using rash analysis. Also, at each visit, we assessed psychological and social adversity variables, and we had a measure of cognition, which is a computerized test that combines tasks measuring different domains. Again, the tasks are combined using rash analysis. So what we did is for each participant, we identify each pair of visit. For example, this is a participant that had visit 1 and 3 and more. Participants have up to 10 visits. And so there were pairs between visit 1 and 2, visit 2 and 3, and visit 1 and 3, and so on for each participant. Then the outcome was a worsening in self-reported difficulties between pairs of visits. So for each pair of visits, the outcome was categorized into 2 levels, either a worsening, which is an increase in 0.5 standard deviation or more, which is usually considered to be clinically meaningful, or no worsening, which is a change smaller than that, or an improvement in cognition. The exposure, we had 2 types of exposure variables that I'll show you in a second. The ordinal variable, we used the value at the last visit, and for the continuous variables, we used the difference between the visits in the pair. The models were adjusted for sex, age at baseline, and years difference between the visits. We use logistic regression model that adjusts for correlated data to regress the binary outcome, worsening in cognition, on the exposure. The exposures of interest were similarly modeled with Poisson regression to obtain relative risks. And to inform the interpretation, we measured the change in measured cognition and also in emotional distress using the mental health index of the RAM36. What did we find? So among 846 participants, we had 7,367 pairs of visit, and in those pairs of visits, 17 had a worsening in cognition. You can see on the right-hand side the characteristics of the participants. They were on average 53 years of age, mostly men, very educated sample. They had been living with HIV on average 16.8 years, most current CD4 cell count 642, but the nadir CD4 cell count on average 208. So if we look at the ordinal variables that we tested, they were taken mostly from the WU-QoL and from the OR, social support. How safe do you feel in your daily life? How healthy is your physical environment? Do you have enough money to meet your needs? How satisfied are you with the condition of your living place? Do you find yourself feeling lonely? And about the stigma, to what extent are you bothered by people blaming you for your HIV? And you see the reference level and the comparison level. I highlighted those with a relative risk of greater than 1.6. And as you can see, several of the tested predictors were associated with an increase in worsening in self-reported cognitive difficulties. This is the result for the continuous variables. We used the total score on the ORS social resource scale. We combined several items from the WOC wall that are under the section of the environmental domain. So you can see that the environmental domain that include most of the variables that I showed has a relative risk of 1.21. When we look at the mental health index, it was also predictive, but this is not what we were looking at. But when we combine the environmental domain with the mental health index, you see that the relative risk decreases, but remains significant. And the BCAM was not associated with self-reported cognitive decline. So in conclusion, is social adversity associated with worsening in self-reported cognitive difficulties that you could find in the clinic setting? Several factors indicative of social adversity increase the likelihood of experiencing a worsening in self-reported cognitive difficulty. This effect was not explained by a change in measured cognition and not completely explained by an increase in emotional distress. These findings support the adoption of a holistic approach in evaluating self-reported cognitive difficulties. I want to thank all the people without whom work this would have not been possible. Thank you.
Yeah.